Hello all. So, as the title suggests, this is all about traveling, especially through the airport, when you have cancer. At least this is how I managed to go do it. For me, a couple weeks after I got done with my chemo and radiation, I actually traveled down to Florida. Now, with that, I kind of waited that couple weeks just so that my immune system could hopefully get back on track to where it's supposed to be, which I didn't get sick afterwards, so obviously something was going right. Because realize there's a really good chance that your immune system is fried. Me, as I keep harping on, good diet, good supplement regimen, my white cell counts never dropped. Hopefully that's the same for you. But with this, I also was going to the airport thinking, okay, I'm going to be getting on a completely full plane going from Syracuse, New York to Orlando, Florida. And if you know anything about Orlando, well, that's the home of Disney. And it was basically nothing but small children on the plane that I was on. As your doctor has probably told you by now, you need to stay away from small children. I affectionately call small children carrier monkeys because they are contaminated with germs. I was an English teacher for quite a few years, and every year at about the same exact time, I would get sick like clockwork. Mainly because I was dealing with teens, but still, same thing applies. Teenagers were bad enough, little kids are even worse. Aside from the problem of being surrounded by small children, okay, well there's a few more perils that you have to go through as you try to go through security. Having cancer, you have probably gone through x-rays, PET scans, MRIs, CAT scans, all these different scans which are just pumping you full of radiation. And after all the radiation that I've gone through, I've gone through multiple MRIs. I still have to get MRIs every 3 months. That's a lot of radiation that your body is taking in. I can't get too many more x-rays because your brain, unlike the rest of your body, never forgets how much radiation that it has been exposed to. So I walked in to the TSA line. You know, obviously you can either go for a pat down or go through the imaging thingy, which is, ugh, don't even get me started on that. But I walked up and I just looked at the guy and he's like, oh, you can step right through the imager. And I was like, no, that's okay. I have brain cancer. Give me a pat down. The guy just looked at me. I was like, no, just give me the pat down. That's fine. Now, before I go on with that, my first piece of advice. If you can, get yourself a belt that does not have any metal on it. I had made the unfortunate mistake of forgetting to do this, or actually I didn't even think about it until I was at the airport. And you got to take all the metal out, everything out of your pockets, put it in the bins, they go through. So I was like, okay, I take my belt off and almost lose my pants because in the past 6 weeks, I went from 155 to 145. So needless to say, my pants no longer fit. So I'm sitting there like holding my pants up. I'm like, oh my God, this is fun. But went through, got the pat down, no big deal. Took a little bit longer than, obviously going through the machine, but whatever. Well worth it. For me, I was like, whatever, do what you need to do. TSA people, hopefully you get a good person. They explain what they're doing as they're going along, which is mainly just patting you down in every area that they possibly can. Making sure that you're not, bringing something in with you. So, tip, as I said, make sure that you actually have a belt that doesn't have any metal on it so you can actually hold your pants up. Because chances are you probably are going to lose a bit of weight after chemo radiation. I used to carry a backpack whenever I traveled by air. Nowadays, however, I have to carry 2 things. 1, backpack. 2, messenger bag. The reason for that is all the stuff that you're going to be wanting to bring along with you. Now, with most flights, you can have 1 carry-on and 1 laptop bag. So that's what I kind of did. Backpack, very good for a bunch of things. For example, this is my medical folder. Always bring your medical stuff with you wherever you need to go because you never know. So bring that with you. That will go in the backpack. Other things that you want to go and put in the backpack. If you have a carry-on, you definitely don't want to be doing this. Your drugs that are really, really essential. This is my Keppra. This is the stuff that keeps me from having seizures. That comes with me. All these are my supplements. Bring those with me all the time, simply because it's good to have them with you. Once again, don't put this stuff, if it's very important, into your checked bag because, as we all know, airports lose stuff all the time. I've been on a number of trips where I've come back and I'm sitting there waiting for my bag. It never shows up. 3 days later, I get all the contents of my bag back, which say, like I didn't have my Keppra, that'd be 3 days without my anti-seizure meds. Probably not too good. So make sure you carry all of your stuff in your backpack. Other minor things. Now, the backpack stuff is great because you can just, put it in there, kind of forget about it. You can put your laptop in there, any books you have. That's how I travel. Because, trust me, there's nothing worse than sitting on a flight with nothing else to do. So bring a book with you, bring your laptop, do what you need to do. Put it in your backpack. That is your laptop bag. Okay, now the side messenger bag, things that you can have with that. Okay, now my bag. Now, as I talked about in my previous video, I talked about my bug out bag. Well, my travel bag is very, very similar to that. Now, I won't go through all the stuff that I put in there because it's a little bit more extra stuff than you could possibly need. For example, I have a first aid kit, stuff like that. But something that is very useful, however, these things, Clorox wipes. Planes are disgusting. And if you are immunocompromised, you don't want to be surrounding yourself or touching everything that can make you sick. So as soon as you sit down, wipe down your armrest, wipe down for sure the table thingy, because that too is disgusting. I've seen parents changing their child on this thing. So, so make sure you do that. Also, hand sanitizer. I am not a huge proponent of hand sanitizer because this is how we get superbugs. But in this instance, you got to keep yourself safe. Slather that stuff on. Makes your life a lot easier. Put your mind at least a little bit more at ease. Have something to carry water in. I like my Clean Canteen. It's multi-purpose. Good to have. Nalgene works just fine. They have collapsible water bottles, which are really cool because they're really lightweight. If you're worried about weight, get one of the collapsible ones. I always carry a bandana with me. If push came to shove, I could put it around my face. Granted, that'd be really, really bizarre, but I could. Earplugs. Because there's nothing worse than being on a plane and you just can't stand the sound of screaming children. Put those in, you're good. One of the more important things, if you know for certain that you are immunocompromised, N95 mask. Be aware, however, this is not some keep you magically safe from all viruses, bacteria, whatever. It's not that good. You would have to get a surgical grade sort of mask for that. But in a pinch, this will work. So, don't go through the x-ray machine. Carry some sanitary stuff with you. Carry a mask, water bottle, all that. Keep the things for sanitation in your side bag. Keep it on your lap or underneath the chair, underneath the space in front of you. Don't put it in the overhead because it's absolutely worthless if it's up there. You want easy, quick access to it. If you're interested in the sum total of everything that I cart around with me when I go traveling, ask me what I do in the comments. I'm not going to put it there unless somebody really, really wants to know. Once again, I go a bit above and beyond, but that's just me. I wear a pair of Doc Martens. I don't wear comfy shoes. I wear stuff that if anything were to happen, I could walk pretty easily, pretty far in a pair of shoes that could do me a lot of good. Once again, that's just me. Put together a bug out bag, there's a reason for that. So with that, Happy travels. Have fun with the TSA. Talk to y'all later.